Um, hi everyone. So this is Donna Wilmot from Catalyst Project, and today we are talking with Dessa Cosma, who is a 2019 Braden alum. And Dessa is an incredibly powerful organizer based in Detroit, and she has a long history of organizing for racial and economic justice. And in 2018, Dessa started Detroit Disability Power to grow the organizing power of the disability community, and also to continue to help bridge the gap between the disability community and other social justice organizing efforts and movements. And Dessa is executive director of that organization, and was also recently a governor in Michigan to the Michigan Coronavirus Task Force on Racial Disparities. So welcome, Dessa. We're so glad that you can make time to talk with us about these things. So I just wanted to begin by asking you about your response to the ways the COVID-19 pandemic has revealed so much about whose lives are considered disposable in the society. And can you talk about disposability politics in the midst of this crisis?
Yeah, sure. And thanks for the opportunity to talk with y'all. You know, one of the first things as this pandemic kind of swept the nation in particular was the conversation around who would be hardest hit by this. And I think there was a very quick conversation, a jump to a conversation of, well, it's just going to be older people and people who are already sick. And by framing it that way, there was this, for some people subtle, for some people very blatant acknowledgement that it was okay if just older people or sick people were taken out by this thing, because those folks are weaker, those folks are less important, those folks are less vital in our communities, I think was the subtext of that kind of quick jump to say, nobody panic, it's just those people, which is super problematic, not only because many of us are those people and we have a right to healthcare and all of the other things needed to survive, but because we're loved by many people. We're the family members of people, we're the caretakers of people, the teachers of people, the leaders of people, and you know, we're not just disposable. And so, I mean, I couldn't help but notice right away that conversation was happening. And a friend and I were having a conversation, and she said, just imagine if we lost all of our elders. Like, what a tragedy that would be if all of the older people in our society, or just a big chunk of them, went missing because of this. And it was sad how countercultural that care for elders felt in that moment. It felt like older people, sick people, disabled people were just kind of this quote unquote necessary casualty of the pandemic, or this expected casualty of the pandemic, which is, in a certain type of thinking, in a utilitarian kind of capitalist, individualistic mindset like we have in the US so often, that logic does make sense, right? That in that framework, people who are less able to have their labor commodified are more disposable. I just really disagree with that value system, and I think it's really wrong. And so, you know, as a disability organizer and a person with a disability, you know, the first thing we really started doing was pushing back on this narrative that it's okay to sacrifice certain people for the sake of other people. In many states, there were medical protocols and rationing guidelines that specifically discriminated against people with certain types of disabilities. And that's illegal. I think it's immoral. It's certainly ableist. And, you know, thankfully, there have been legal fights against that, but in many states, including Michigan, where I live, the guidance is actually still pretty vague. And so when a disabled person or a person with a chronic illness in Michigan reads the medical protocols, we all get nervous and think, would I get treatment? If I went into the hospital, would I be one of the people that got a ventilator? When a lawyer reads those guidelines, they tend to think, well, it's kind of vague, so we can't really file a lawsuit, right? And so, we've been really advocating here for an executive order that clearly states that civil rights are non-negotiable, even in a crisis. And we've been having a lot of hard time getting traction, honestly, which I think speaks to, again, who's considered disposable, who's considered a priority. And so we're just going to continue to push.
I have been reading accounts online about, I think in Massachusetts and other places, I know in California, there's been a big pushback against the guidelines that you were referring to that really prioritize people's, what is deemed to be a certain quality of life that is honored and respected. And there's been a lot of organizing pushback against that. I'm wondering how that is playing out on a community level. Are there like know your rights organizing efforts, or like what kind of on the ground efforts are being made to make sure that people know what they're able to fight for, in addition to like policy changes, like on a community level, what are people seeing and doing?
Yeah, I mean, a couple of things come to mind. It's been actually really awesome the way the disability community across the country has come together to educate each other and others about what rights we do have from these kind of disposability policies. And I've been really pleased with the way that the access to being able to learn from each other. It's just like every day there's an awesome webinar or panel from really brilliant and intersectional disability justice thinkers about how we can organize and what the laws are and what our rights are and how we can take care of each other even outside of the role of government. And so I've been really impressed by that. And I've been impressed with how those conversations are about disability, but in relation to other identities and lived experiences that people have as low-income people or people of color or immigrants or incarcerated people, and just really tying all of these issues together, knowing that people are facing disposability policies from multiple angles and sometimes many at the same time. Another thing locally that I think has been really positive is a group of about 110 social justice organizations from around the state signed on to a pretty radical letter to the state government about our demands in this time. Everything from a moratorium on evictions to a rent strike to making sure nobody has their utilities or water shut off, all sorts of things. And these are groups that often know each other or work together in pockets, but have never all come together to kind of work together on a campaign. And right now, what we're doing collectively is making sure that our state doesn't reopen prematurely. And so here in Michigan, we have one of the more strict stay-at-home orders, and it's one of the first ones that got implemented. And so, we've been at home for 6 weeks now. You may have seen these right-wing protests that happened in Michigan last week that were really disturbing and really demanding that the government open up for the sake of business. And we are one of the hardest hit states. Detroit in particular, where I live, is one of the hardest hit cities. And so to reopen a state right now would be so irresponsible and so dangerous. And particularly for people with underlying health issues, or for people who don't have some stability in other ways that make them more vulnerable to sickness and death. But really, it's irresponsible and dangerous for everyone. This is a highly communicable disease. And so it's very frustrating to me that these folks who have been protesting in Lansing and wanting to reopen the state don't understand how connected we are to each other, and don't seem to care that there have been 2,500 people in Michigan die in the last month. And over 30,000 people sick. And so, this group of 110 social justice organizations are pushing back with a campaign to our legislature, telling them not to reopen the state. And we're focusing that in many different ways, like for the sake of incarcerated people, for the sake of low-income people, for the sake of disabled people, for the sake of workers. I think we're doing a really good job of coordinating the campaign, but staying focused on the ask.
That sounds amazing, and it also resonates with other stories that we've been hearing in other parts of the country as well. And I know that so many of us are feeling emphatically that we don't want to go back to normal. The old normal was really problematic, and we want something really different. And I think a lot of us are looking for a way to push a really bold agenda that will bring us closer to the world that we want, and that's built on justice and equity. And I think what you're pointing to is so important, Dessa, about building on intersectional, cross-movement approaches that really deepen those bonds of solidarity that we have with each other that a lot of times we don't feel deeply and don't act on enough. I'm also wondering if you could talk a little bit more, just from your organizing and your lived experience in Detroit, about the racial disparities, the racial impact, both clearly before this pandemic and how that's been exacerbated in this period of time. Because, could you just say a little more about that?
Yeah. So Detroit is a city that is upwards of 85% African American, and has a long history of Black leadership and civil rights work. We also, unfortunately, have a long history of segregation and disinvestment by the state. And, Detroit went through bankruptcy about 7 years ago. And the amount of poverty here, the depth of poverty here, that has been caused by disinvestment and racism, is really intense. It was intense. It's been intense. And I think as this pandemic has unfolded, it has not been surprising that a place like Detroit would be so hard hit when there are so many people that were kind of barely making it before, in terms of having enough resources, and having any sort of access to what they need. And so we also have had 100,000 people without running water over the last few years, which means it's really hard to stop the spread of a disease if you don't have running water in that many households. So the combination of lack of resources, stable housing, stable utilities like running water, healthcare, means that, we really were primed for something like this to hit really hard. And Additionally, the folks who are essential workers here in Detroit, so the bus drivers, the police officers, the grocery store workers, those are mostly African American people. And so the very people who are keeping our society going and putting themselves at risk are then getting COVID, and some of them dying. So, you know, I think no one here is surprised, but also it just like reiterates how the inequity, the underlying inequities are really dire, and are coming even more into focus, I think, for some people who didn't see them before. But again, the reaction by some of the folks outstate, it's hard for me to not think about the timing. So right around the time that we started really clearly seeing the racial disparity is when a lot of white conservative folks in other parts of Michigan said it was time to go back to work. And it just makes it so clear who they think is valuable and who they think are their people and who is expendable.
Yes. Completely agree with you about that. Yeah. I'm wondering if you've seen any other kind of organizing efforts that have inspired you in this pandemic. I mean, I think we're all learning a lot from the disability rights movement, disability justice movement, about the preciousness of every life and about our interconnectivity. And I'm also just wondering if there's other things that you have seen that have inspired you in this moment, other organizing efforts around the country.
Yeah, two things that come to mind. One is it's local. I think it applies to other places though. That, you know, there's been a campaign for years for safe, clean, affordable drinking water here in Michigan after the Flint water crisis and because of all the shutoffs in Detroit. And we just hit the 7-year anniversary of the Flint water system being switched over to what ended up killing and sickening lots of people. So this organizing has been happening for a long time, and it's kind of unfathomably to me, the powers that be have not been able to say that water is a human right. And yet when this pandemic hit, there was an executive order that was pushed for by these same water activists to ensure that all the water was turned back on. And so while the jury is still out, if the state is fully following through on that, that was years of organizing that was able to culminate in a crisis to, you know, basically force the state to acknowledge that water is necessary for all people. And then secondly, I've been inspired by the work done by prison abolitionists. The work to get people out of jail and prison has been really remarkable to see. And just reminding people that weren't already aware of the humanity of people that are incarcerated and how vulnerable they are in these times, but also the ability to actually get people out. Like, it shows that it can be done and that if there's willpower to do it. That's been also really inspiring.
And what advances have been made in either in the local jails or the prisons in Michigan that you've been aware of? I feel like there's been a lot of calls nationally for release of many categories of prisoners, older prisoners, prisoners with underlying medical conditions, which is probably 2/3 of the population of incarcerated people. I know in Catalyst, we've been working very hard to support the national Black Mamas Bailout campaign so that people who are languishing in jail because they don't have money for bail can come home and not be exposed to COVID and bring that to their families. But I'm wondering how successful it's been, because I feel like it's been uneven around the country. Like there's been some efforts, and it's, in my opinion, been a little timid by the powers that be, except in a couple places. But I'm just wondering what it looks like where you are.
So I'm gonna have to get back to you on some of the specifics of that, but I do know that a lot of people have been, I don't know if it's, I don't want to say a lot because I don't want to underplay like how many people are still there. People have been let out, and there has been the problem is I'm not totally sure where the campaign is at this moment. I haven't checked in a few days, and so I'm a little out of the loop on some of the details. But I know that people have been let out, and that there is has been a reduction in incarcerating more people on purpose. That has been intentional because of the organizing that's happening and the pressure that's been put on the state of Michigan. And so the folks who are doing the abolition work here are still pushing, but have been pretty surprised at what they've been able to accomplish in the last month under these circumstances.
That's great. And I think, what you were saying earlier about the ways that we need to see our common connection, and about when more of us are safe, it's better for everyone, that it's, and I think that that's also true around jails and prisons, and I think a lot of people they see that as a very separate community over there, not having anything to do with us. And I think, both for staff who are working in jails and prisons, but for prisoners who have no choice about whether to be there or not, lifting up the humanity and feeling the connection to people, that they are not separate from the rest of us, even though they're in cages. They are still part of our community. And as you were saying earlier, these are people who are loved. These are people who have families, who are leaders, who contribute to their community, and they need to be respected as such. So I'm really appreciating the decarceration efforts that are happening. I think we don't have a lot more time, but I did want to ask you if there were any specific asks from that you know of from folks who asks from people who are in solidarity and support of disability justice organizing and movements, if there are particular ways that people can show up in this moment and really show a deep solidarity. I know there is a campaign, the nobodyisdisposable.org campaign. And we'll let our listeners know more about, give links to that later. But I'm wondering if there are concrete things that you can suggest to people who are listening to this about actions they might take.
Sure, yeah. This sounds like not a very big action, but I think it's important. When there's a conversation that's going on about reopening our state or our economy or whatever it is, and there's a tone to the conversation or comments in the conversation about it's only vulnerable people who are at risk, or it's only older or sick people who are at risk, really pushing back on that and asking them what they think that means. I spent a lot of time at the beginning of this trying to figure out what non-disabled people were picturing, who they were picturing when they were thinking about this necessary disposable population. Were they picturing their grandmother? Were they picturing their disabled neighbor? Were they picturing their friend on dialysis? Who is this unnamed group of people who it's okay for them to get sick and die so the rest of us can get back to our life. Like really pressing people with that mentality to try to think more complexly about it, and pushing back on this narrative that quote unquote those people were going to die anyway, which is something I've heard, and I think is really disturbing. I also think it's really important that people understand what their healthcare rationing protocols are where they live, and like who decides who gets a ventilator and who decides who gets treatment or who gets even a test, right? And looking into that and raising questions about that, starting conversations about it. And then I also think, as we're seeing states roll out plans for greater testing and for being in this for the long haul, which it looks like we will be, really pressuring people in decision-making power to have proactively disability inclusive plans. Right now, we're still fighting to make sure that there's closed captions and American Sign Language in all the press conferences from the health department, right? So what we really, we need to be able to be beyond that, and to a place where the plans that the governors and their teams are rolling out have actually consulted with disability community to see what are the things that we need, that may or may not be different than what other people need. But if we're not considered in those plans, it's a guarantee that we'll fall through the cracks, particularly in a crisis, because we fall through the cracks on a good day a lot of the times. And so, being proactive, getting people to think about these things from a perspective of what disability community needs, but not obviously at the exclusion of what other communities need to. I think there's definitely a way to hold the complexity of it.
Thank you. I think that's so important what you're saying about just getting people to stop and think about the implications of these things that might seem, of course, they have to make difficult choices about
Right.
a ventilator or about difficult choices about who's going to get tested, and really interrogating those assumptions. I think that's really important. I also think that, we've seen a lot of really amazing mutual aid efforts being organized all around the country. And I know here in the Bay Area, the Disability Justice Culture Club has been doing amazing work, both, setting up mutual aid networks so that folks who are not in a position to go grocery shopping or, can get assistance in those day-to-day survival things in this pandemic, from people who are able to just throw down and be part of that. But also the Disability Justice Culture Club was turned their living rooms into hand sanitizer manufacturing, home manufacturing stations, and those those sanitizers were then brought to the encampments for unhoused people, and that level of solidarity and showing up for the whole community, and that example of everybody needs to do whatever they can from wherever they're positioned in the society to mitigate the harm of this pandemic, and not just to mitigate the harm, but also to model the kind of relationships that we want to be the basis for the world that we want, the ways that people see each other, see ourselves as deeply connected to each other and all worthy of respect and dignity and all the things that we need to survive. So yeah, go ahead.
Oh, I was just thinking about one of my favorite things to think about that you reminded me of, which is, people with disabilities have been having to navigate an ableist culture forever. And it's hard. It's not the way it should be. And we've gained a lot of really important skills from having to do that. And those are skills that are particularly useful right now, right? So like really understanding interdependence, really knowing how to ask for help, being flexible and adaptable, being patient, being creative problem solvers. Like those are things required of disabled people all the time because things were designed without us in mind. And in this time of the pandemic, everyone is being required to be creative problem solvers and patient and adaptable and flexible. And I think we have a lot to offer in helping people rearrange how they are to meet the needs of the time.
Thank you. Yes, yes, really appreciate that. Were there any other closing thoughts that you would like to leave our listeners with?
No, I don't think so. I appreciate you all and having this conversation, and you know, please send your positive energy to Detroit. We got amazing people here, and a lot of folks are struggling, and we're doing everything we can to take care of each other.
Thank you so much, Dessa, and thank you for your leadership and everything that you bring to these movements. And you're such a brilliant organizer, and we're really grateful to be in community with you, even across distance. So thanks again for everything, and take good care. Okay.
Thank you for being such a good role model.
All right. Thanks, Dessa. Bye-bye.
Bye.